just introduce yourself, who you are, what you do, and then after that, we'll jump into the questions, okay?
Great.
And if there's anything you want to ask me or anyone else, just go into the chat section, and then just, if you don't want to say it, just put it in the chat section and we'll see it, okay?
Are we live right now?
We're going live.
Okay.
We should share it on all of our Facebook Live pages.
Yeah, they're doing it on Facebook and YouTube.
Have a quick second as we go live. Assemblywoman Rodneyse, I'm doing some work in your district, so I'm hoping to get in touch with you at some point. I'm doing some major research in Little Haiti. I just wanted to kind of bring you on board and bring you up to date.
Okay, look forward to it.
All right.
Live.
All right, we're ready to start. We're gonna give everyone a chance to come in. As we all know, often it takes a little bit of time to get people on when a live goes on Facebook or YouTube. But I wanna thank all of you for being here, for joining us and taking the time to participate in the National Alliance for the Advancement of Haitian Professionals, the NAAHP, for its first virtual symposium. Unfortunately, it is under very difficult circumstances that we are brought here to talk about COVID-19 and what is going on and how it's impacting our community. Our goal today is really to help bring, to share information about what our work, what we're seeing in our respective fields and domains, to give insight, and also to give some guidance as well, right? Because this is unprecedented, and all of you are leaders in your field, and your insight is crucial, it's very important. And so welcome and thank you for joining us this evening for an in-depth conversation focused on the Haitian diaspora, as well as Haitians living in Haiti, living at home, and the impact of COVID-19 on all of our lives right now. The NAAHP has convened these thought leaders, Marleine, Bastien, Patricia, Lafontant, Ambassador Altidore, Assembly Member Rodneyse, Bichotte, as well as Dr. Gardere, who will be joining us very shortly. We are convening these experts in their fields to talk about how are they seeing the implications of COVID-19 manifested in our community. My name is Milka, and I am the CEO, and I'm the CEO of my own company called We Are Artemis Leadership. It's a leadership and consulting company based in Miami. And I am also a speaker, an author, and a coach. And I work in the community, and I am very passionate about making sure as Haitian Americans, as Haitians, that we stay connected and we help advance the cause of our people. So this is a great opportunity, even though the circumstances are challenging, but now is an opportunity, I believe, as well as the NAAHP, to start thinking about going forward. As we're grieving, as we're dealing with this situation, what can we do? How can we support? What insight can we provide? And so this is why we're here. Our goal for this virtual symposium is to engage medical practitioners, social advocates in the community, politicians, psychologists, and to bring all these thought leaders together to discuss COVID-19 in a way that is helpful to all of us. This is a conversation that really we're sharing our information, we're discussing it, but we also want your input. We need all of you to participate, ask questions, and to get involved. our primary area of focus for this session today. And I believe the goal is this is going to be a series. There will be more coming in the future. But for part one of this COVID-19 symposium, we're going to focus on healthcare. We're going to focus on community resource availability and access, as well as access to assistance that may be out there. We're going to look at it through multiple lenses. We're going to look at it through the business community, political frameworks, and what's going on both in the United States as well as in Haiti, and the impact it's having personally on us, as well as public health issues and what can we do to help mitigate the impact of COVID-19 on the Haitian American community in the United States, as well as in Haiti to the extent that we can. During the first hour of this symposium, we are going to have each speaker speak for between 10 to 15 minutes. They're going to introduce themselves as well as answer a few questions, and each one will have an opportunity to speak in regard to the particular domain. And then the last 45 minutes of this session, we will take questions, and it will be an opportunity for a more conversational approach, and we will be able to speak to each other, answer some of your questions. So we encourage you to direct your questions in the chat section of both either Facebook or YouTube, and all of those questions will be assembled and organized by the organizers, and they will be shared with all of us. Premièrement, c'est en anglais n'a fait symposium ça, mais nous connaissons que des gens qui pas parler anglais ou ka un petit gens côté ta vle so souvent question créole ou bien si aucun monde là qui t'a voulu répondre question créole ou bien en anglais, that's okay. So n'a kon bagay la n'a parler ni anglais ni créole, n'a prend Jean Liéa. So but primarily we are going to do it in English. So that being said, so if anyone has any questions, when you do post your questions, please, or if you do take pictures or whatever you do, please use the hashtag NAAHP COVID-19 Symposium, as well as hashtag NAAHP. In addition to that, Chakarella, which we also would like to thank our media partner, Chakarella, who is streaming this live on the platform. And lastly, I would like to thank the NAAHP, the president, Serge Renaud, as well as the entire organizing team who's worked really tirelessly during the last few weeks to put this together for our community. So thank you all of you for doing this. And last but not least, I'd like to thank all the panelists for giving your time, your energy, and just being your commitment to supporting the community. So again, thank you very much for your participation, and we're gonna get started. So I'd like to ask, so we're going to begin, I'm going to share some initial data that by now, okay. So I've just learned that it's Facebook Live. That's where most of this, that's why we're being primarily streamed. So in regards to these numbers, many of us, we see it every day. First thing you do, you go on Google, you put COVID-19, get the numbers. So worldwide, we have 5.17 million confirmed cases of COVID-19, 336,000 deaths. In the US alone, we have 1.63 million cases, 96,251 deaths and counting. So the US is almost about a third of in terms of deaths, we're about a third of the world's number in terms of confirmed COVID-19 deaths. In New York, which we know that the Haitian community is huge in New York, primarily in areas like Brooklyn and Queens, Long Island, the Bronx. 358,000 confirmed COVID-19 cases in New York, 195,000 deaths. And then Florida, another area that has a huge Haitian population. There are 48,000 confirmed cases of infection for COVID-19, 48,657, and 2,144 deaths as of today, May 22nd, 2020. Okay, so I've been asked by the organizers to if people can go to the NAAHP YouTube channel, it's live on the NAAHP YouTube channel. So to access this symposium on YouTube, go to the NAAHP YouTube channel and you will be able to see this event live. Okay, perfect. And also same thing with Facebook as well. Okay, so first to get started, I would like to start, well, I've shared these appalling numbers and we all know, I was just talking to Marleine before we even got started, that we've all been, people have family members or friends or relatives that have either been impacted. I have two family members who've been impacted by COVID-19. They're elderly people. And this pandemic is hitting close to home for many of us. And so it's definitely, and on many levels, whether it's the economic impact or the social impact, or personally, people you may know who've been impacted or who even died. This is not easy. This is a very challenging time for everyone. I would like to start, for us to start on this panel with Nurse Patti, Patricia Lafontant, who will focus on the healthcare aspect of this pandemic, because we know that they're at the front lines of this pandemic, and at the end of the day, it is a healthcare crisis that we are in. And so I'd like to start with you, Patricia. If you could tell us a little bit about who you are, what you do, and just introduce yourself to everyone here.
Hi, everybody. Thank you guys for joining in. I'm Patricia Lafontant, also known as Nurse Patti. I am a nurse practitioner. I graduated from Florida A&M University undergrad and from Duke University graduate school. I've been on the front lines and my face has been very recognizable because I was the face of the Dove campaign, Courage is Beautiful, which highlights frontline workers all over the world, not just the country. I was a guest host on the Dr. Oz show talking about flu prevention, which is a very common virus that we're familiar with. And I also was part of a piece in the New York Times and Washington Post talking about healthcare providers, the mental impact COVID-19 is having on us, as well as the shortage of PPE, which we all are very concerned about. So that's like a brief bio of mine in a nutshell. I'm very active in the community. I'm from Miami, Florida, but I've been living in Washington, D.C. for the past 7.5, almost 8 years now. And that's me. I'm Nurse Patti.
Great. Thank you for taking the time. First of all, thank you for your hard work, what you do, and what other nurses. I know in Miami, we have a lot of female nurses in our community here. So we want to say thank you for all of that you are doing and the level of risk that we know all of medical professionals are under right now. What I would like to do is, I would like to start with our first question, which is, what is the healthcare impact of COVID-19 on the Haitian American community? I know it may be challenging, we may not have all the numbers because for demographic reasons, but if you could perhaps speak to some of the impact and also look from a public health perspective, as well as with just what you're dealing with within the hospitals, what you're seeing and what other nurses are seeing and other doctors are seeing and dealing with right now.
So, like you said, I can't quote statistics or demographics because most Haitians identify as Black if we're talking about ethnicity or race, but it's impacting the Haitian community just like it's impacting the African American community. Haitians suffer from high blood pressure, diabetes, and high cholesterol like any other person of color in the African American community. And I mentioned that because comorbidities put you at a higher risk. When COVID-19 was first being discussed, it was more known as a white disease and an older disease of people who are already sickly. And through testing being more readily available, we were able to find out that that was not the case. As we tested more, we noticed a rapid, huge incline in the Black community. And that was irrespective to age. It was really due to comorbidities, the things that we suffer from and have been suffering from for many, many years. So right now, healthcare disparities is a big buzzword in the media, but it's not new. Healthcare disparities that exist in America is not new, even with the healthcare that we have. So in respect to the Haitian community, if we're doing this bad in America, you could only imagine what the ramifications could be in Haiti if there is not a good grasp on exactly what is going to be done. And my biggest concern for Haiti is the infrastructure. In America, it's easy to tell someone to quarantine and they have their own bedroom. That is not necessarily the case for families who reside in a very small space, who have to go in and out every day to work. So again, it's a catch-20. It's very difficult to give the same instructions that you would give to a first world country to a developing country, because I don't like to use third world.
Yes. So Nurse Patti, Ambassador Altidore will speak to some of these issues as they pertain to the Haitian community in Haiti. Can you tell us a little bit more? You mentioned the word comorbidity. Can you talk a little bit more about that? Because some people may not know what that actually means and what it means in regards to COVID-19.
So comorbidity just means that you have a health condition. So comorbidities, I have no comorbidities because I have no past medical history. But most people with chronic diseases, those are considered comorbidities. The ones that cause the most issues are the comorbidities, such as asthma, obesity, high blood pressure, diabetes. Those are the most common comorbidities in the Black community and in the country worldwide, because those things lead to a slew of other disease processes. High blood pressure leads to kidney failure, diabetes leads to neuropathy, to blindness. So these are conditions, diseases that already affect your body, and it's chronic. It's not something that you can cure. It's something that you treat. So when you get attacked with a virus like COVID-19 and you're not already in the best health, and this is irrespective to age, you are at high risk of death, which is morbidity. Mortality, you are at risk of death. And that's why we keep hearing comorbidities, but that's just, you have a health condition, and it's not that you're not healthy or you're sickly, but you have a condition and you've had it over time, and it affects your body and your organs. I'm sorry.
No, I was just going to ask you, what suggestions would you give to people? We know a lot of people in the Haitian community, Haitian American community, suffer from some of these chronic diseases like hypertension, diabetes. In light of what we know today, right? What suggestions would you give to people from a health perspective of what they should or should not be doing right now? In addition, how they can keep themselves safe in the coming months, because this disease is not going anywhere anytime, at least not in the next few months. Yes, the numbers are going down gradually, but what can people do who already have these diseases in addition to whether it's quarantine or wearing masks or whatever, washing their hands? What more can they do for their health to stay healthy right now?
So, of course, the CDC guidelines is what we've been following, talking about vigorous hand washing, wearing masks when you're outside and quarantining. But I want to go a little bit deeper. If you are someone with a health condition, when you talk to your primary care doctor, you can do it via telemedicine, which means the way we're talking to each other right now is how a lot of doctors are seeing patients. Instead of getting a 30-day prescription, ask your physician to extend your prescription to 90 days. So you can limit how many times you have to go to a pharmacy or CVS. Your diet and your lifestyle right now is more important than it's ever been. Anybody who comes into the hospital, no matter what their symptoms are ruled out COVID. So what that means is you're presumed COVID positive until proven otherwise. And that's very concerning, because the whole hospital right now is being treated as the whole thing is COVID. When it first started, you had a COVID zone or a COVID floor. The whole thing is COVID now. Mm-hmm. And so people who are already sickly, we don't want to expose them to the virus, because basically the virus is living in the hospital where all these other people are. So if you can manage your symptoms at home, definitely manage your symptoms at home. Your food choices, your lifestyle choices. This is the time to get active at home, go to your backyard, run in place, walk, jump rope. It's very, very important that we stay active, even though we're dormant and we're home and we're bored. What we tend to do when we're bored is eat.
Yeah.
And right now, you know, Patti, pickles and all that, that is like the enemy right now. So we
drinking.
have to stick in drinking and smoking. Drinking. Yeah, so we have to stick to the asauce and to the legume, because right now we need to be our healthy and our best selves. But a lot of my patients, they don't really think about it, but especially the older patients on medications. Yeah. I'm telling them, get a refill that's good for 3 months or 6 months, so that you don't have to go to the pharmacy, or you don't have to panic and try to get a doctor's appointment and it's too late. Be proactive in your health. If you know, check your blood pressure every day at home. You can check your blood glucose at home if you're a diabetic. There's a lot of things that we kind of take for granted because the doctor's right there, the hospital's right there. What we're asking people is to be just a little bit more accountable for themselves and their health. Educate those around you. You know, in the Haitian community, we still have a lot of family members here in America that don't speak English. Take your time to explain what the coronavirus is. Not just it's corona. What is it? It's a virus that attacks your respiratory system. Not only your respiratory system, but other organs as well, because now we're finding that after people recover from COVID-19, they're having mini strokes and heart attacks. So this virus is ever changing. It's affecting children right now in a very rare way, and it's very indescript. Nobody really knows. This is new to us. We don't really know what the long-term effects of the virus is. So the goal is to not contract the virus at all. And the numbers are also skewed for, yes, they're going down, but people have to understand the CDC kind of had a mix up with the numbers because they were testing for COVID. They were also doing an antibody test, and the numbers got messed up. So the numbers are not as accurate as we would like them to think. So as the country is opening up, I want our community to be very careful, not to run into open spaces like restaurants and salons, because just because the country is open doesn't mean that it's safe. It doesn't mean that you won't get sick. It doesn't mean that the virus has won away. Summer's approaching and winter is going to come right after. Right. The healthcare community, we're actually expecting a second wave, a surge, even worse than before. So while I don't want to be dreadful and pessimistic, but just realistic. If we know what it did to us economically the first time, if this thing hits us again worse the second time, it can be economically devastating all around. Yeah. There may or may not be government assistance the second time. You know, PPE has been short from the beginning up until now. Yes. Probably and going to continue. Right. Personal protective equipment, what we wear, our isolation gear that we don to treat patients. So we have to also think about long-term, what our resources are. And beyond health, we have to come up with a saving plan. Yes. And we have to come up with a plan on how to support our families in the event that we cannot work anymore.
Okay, so Nurse Patti, thank you so much for sharing your healthcare expertise. And I love the suggestions, especially talking to your family members, making them much more, particularly the older ones who may not quite understand the science, breaking it down in the most simple way so they really do understand this disease and how it works and how it can easily impact us. So thank you for sharing that. We will have an opportunity toward the second half of the symposium to get back to where you can perhaps answer more questions. But now we're going to go to Assembly Member Bichotte, Rodneyse Bichotte. So Patricia, Ms. Nurse Patti, if you could mute your microphone, and Assembly Member Bichotte, if you could unmute your microphone. Thank you for joining us in this symposium. And if you could do a quick introduction of who you are, and in addition to that, and then after that, I have a few questions I would like to ask you.
Okay, well, thank you so much, Milka, for having me here. It's a great opportunity. It's a great opportunity to be serving on this panel with these profound panelists, Marleine, Bastien, Patricia, Lafontant. Thank you so much for all the work that you've been doing and being on the front line and being such a great essential worker. Thank you so much for saving lives. And my good friend here, Ambassador Paul Altidore, nous manquons, oui, nous manquons d'ici. I look forward to working with you in Little Haiti. I'm really pleased to be part of this. Just a little bit about me. I am an assembly member of New York State, which is considered rep, I guess, state rep in some other places. And I represent the largest Haitian community in the state of New York. We had established Little Haiti, and we're very proud of that, where we also unveiled a 3-mile street called Jean-Jacques Dessalines and re-unveiled Toussaint Louverture. So we're working hard to reconnect the people in our communities and that our people can stay. Recently this year, Martin Luther King Jr. Day, I was also named the new Democratic Party leader. So
congratulations.
Thank you, thank you. And you know, that's another role, another hat, where I'm in charge of 1.2 million Democrats. I'm the leader of 1.2 million Democrats, which is the largest single county of Democrats in the whole United States. So it's a big role, and I'm happy to be in that role and help many other elected officials. Born and raised in Brooklyn, Flatbush. I wear several hats. I was a former math teacher, a former electrical engineer, and a former Wall Street banker by way of getting my MBA at Northwestern. And, you know, came back to the community and ran for office, and I am here.
Wonderful.
So that's just a little bit about me.
Well, it's a pleasure to have you here. I mean, this is such an illustrious, that's why I decided, I was like, if I were to read all these bios, like we'll be here for 2 hours just reading bios. And so that's why I figured it's just easier to just have all of you introduce yourselves, and everyone gets to see more information on the chat live. And again, everyone, if you feel free to ask questions. Nurse Patti just gave us some great information about what you can do for your family, for yourself to stay healthy. She was very insightful. Now we're going to switch gears with Assembly Member Bichotte, and we're going to talk more now. We're going to focus more on the economic impact. Assembly Member Bichotte Rodneyse is, she's done a lot of interesting work in New York around business development, economically helping the Haitian American community and also the larger community in terms of the work that she does. So she's a great person to speak on some of these issues. So my first question for you is if you could tell us a little bit about what initiatives do you have in place right now in your district in New York to help support communities during this crisis, during COVID-19?
Well, there's a lot of initiatives going on. First and foremost, when everything started, we felt that there was a lack of testing sites. They were being very particular in terms of who's get tested. And so we worked with the governor, and we're able to open 2 big testing sites in Little Haiti, where one of them is a drive-through at the big Sears parking lot, which was great, could serve up to 1,000 tests a day. And then we realized that a lot of people don't have cars. So we opened up a walk-through COVID testing center, which is actually being managed by a number of Haitian nurses and Haitian executive director. It's open to the public.
And where is this? Can you tell us exactly where this is?
Yes, it's 1095 Flatbush.
1095 Flatbush.
Flatbush, right. It's right in the heart of Little Haiti. It's the Brookdale Center. But of course, you have to make an appointment in order to, go in and get tested. Okay. So those are some of the, the testing was great. Then we wanted to expand the testing sites. And so the governor and the mayor had decided to put some of the testing sites in the churches. The only problem is a lot of the Haitian churches were left out. And so we're not right now. So right now we're working on some of the large churches to bring in testing sites. But with that, we had an issue with food pantries. We had opened up all the schools to provide grab and goes. Initially it was for kids where they would give free meals, but then it was open up to all families. And, we had some in kosher and halal. And then we were trying to pantry up, and we noticed that there was a big void again in the Black immigrant community. Okay, there weren't that many food pantries. So what we did, we teamed up with the food banks, and we teamed up with the mayor and the governor to register the churches in muted?
You were muted. I don't understand. I'm not sure what happened, but you can continue, please.
Okay, I'm unmuted. Okay. I don't know what was the last thing you heard, but we are working with some churches and the nonprofits to make sure that they become a food pantry. It's taking a little bit of time, but that was an issue. What we also been doing is that unemployment. So a lot of people are unemployed. This is the single most issue that we have in our district and across the state of New York. So we partnered with Department of Labor to make sure that there's language in all languages, assistance. So when people call, there's Haitian Creole, people can call and there's Haitian Creole. But we also had a lot of people calling the elected officials because we have a specific portal that serve unemployment issues. We would actually register the people ourselves on the portal and they would be prioritized. As me, we get a lot of Haitian people calling, but we were getting, because I'm the Brooklyn leader, we're getting a lot of calls from all over Brooklyn.
What were some of the biggest needs when people were calling? What did you see any patterns in some of the biggest areas where, what types of jobs are people losing? What is the need you're seeing right now?
Well, the need, everybody was impacted. I mean, people who, we have a lot of Haitians in the hospitality program in industry. So the hotel services, right? The restaurants, obviously, the barbershop, the hair salon, just a lot of retail stores. They just could not sustain themselves. And I will go into, I know we're going to talk a little bit about the economic stuff.
Yeah.
But mostly they just could not sustain. And so I educated them that it's not only unemployment insurance, but we also had other insurance like pandemic unemployment. So even if you were, let's say, not working, or, well, not necessarily not working, but even if you were not laid off, but you left or you were impacted somehow, there's ways that you can still get some insurance by it. For example, there are some people who worked as waitresses and waiters. There was a way for them to get some unemployment insurance. In addition to that, a lot of people had to leave their work to take care of their people at home.
Okay.
So we implemented the paid sick leave and the family leave as an executive order and as a bill when we went back to Albany. So that was crucial. It was crucial, and the thing is that language barrier was a big thing. People were dying in their homes. People didn't know how to get access to resources because there was a language barrier. Obviously, people were scared. People were told to be shelter in place. I mean, you read the statistics. In Brooklyn alone, we have like close to 54,000 people who died. That's a lot of people in one borough. That's a lot of people. So we've been trying to manage as much as we can. Right now on Memorial Day, and for Haitian Heritage Month, right under Toussaint Louverture, we are going to be distributing over 4,000 to 5,000 masks. This will be cloth masks, and it will be cloth as well as non-cloth masks, but in sanitizers and so forth. We're going to do it at Toussaint Louverture Boulevard, right by St. Jerome, which is a landmark in our community where there's a lot of Haitians. And today we had a number of people who actually volunteered to put, using social distance, to put the kits together.
Okay, great.
But we wanted the Haitian community to know that we are there for them too. So we've been promoting it in the churches as well as the radio. So we've been doing things that we can to make sure the Haitian community know.
So what about for small business owners? I'd like to talk about that. People who have small businesses. What has been your, the CARES Act was passed, and we know that, first of all, data was not collected in terms of, who was receiving it by ethnic demographics. It's actually now they're asking for it when the loans are being the applications for forgiveness. Now they're asking, okay, say if you're Caucasian or Black or Hispanic or whatever, so we're really going to see it. But as of now, we know that in the African-American Black community in general, only about 5% has actually received, the PP, as business owners have actually received, the loans that were given during the CARES Act by the government. Do you have any thoughts on that in terms of the impact on small business owners and how are they managing?
Yes. So just, I forgot to also say that I chair the Minority and Women Business Enterprise. So that's a big thing for me. And you are right. Initially, when the administration and Congress and the Senate had launched the first part of the CARES Act, it was about $349 billion that was going out to businesses. Within the 13 days, all the money ran out.
Yeah, before that.
All the money ran out, and usually it was 80% of the 349 were by really bigger businesses than small businesses, right? Larger businesses. So then they reissued another 320 billion. And what they did, they took 60 billion out of that to put it into community development financial institutions. And the reason why they did that is because they were noticing that the minorities, the Blacks, were not getting any money, but they were being turned away by the banks. That was the issue too. The banks were not approving them to get the loans. So they put in $60 billion so that they can find alternative ways of getting the money, CDFIs. Here in New York, we've been working with organizations like True Fund and Renaissance and so forth. And that's been the way for the minority community.
Can you say some of those can you say the names of some of those organizations again, just in case there's another round of funding and people know who they should be going to as a minority, particularly in New York, for example, to get funding? So can you say those names again?
Yes, so one of them is True Fund.
True Fund.
True Fund is one. We've been working with the small businesses services. Mm-hmm. We've had the Hebrew Free Loan Society. We had the Honeycomb Credit. We had the Kiva, Kiva. Mm-hmm. We also had Womply, WOMPLY. Those are some. We have there's a web funder. And there's something called the Fund Rocket, which is also with the Womply. These are some of the participating CDFIs that has been very, very helpful in terms of giving resources, loans, and so forth. We also launched something that's called Bring Back Brooklyn Fund.
Okay.
And they pretty much raised over $1.5 million. And I looked to see who were getting them. There were a few Haitian organizations that got some funds, $10,000 here, $10,000 there. So that was that. I would like to say that there was the emergency injury disaster loan that a number of people got. EIDL. This loan was more for people who didn't have, who were more like independent contractors, so right. Up to 10,000. If you had people working for you, like on the W-2 level, then you applied for the PPP, as you mentioned, the protection program, which again, let me tell you, for a lot of the people who have small businesses, it didn't work because it was so restricted. It gave you only 8 weeks and 75% of the money had to be used on payroll.
Yes.
So you could not lay off or furlough any of those people. That was an issue. So we are rethinking this. So this is what's happening now. Right now, there is a $3 trillion bill for another set of PPP. They are taking everything into account. They are going to hopefully set aside certain dollars for micro businesses, which will limit it to real small businesses. We're hoping that is, this would also include $35 billion for the New York State government, by the way, because New York, as you know, has been hit the hardest.
Yes.
there's other things like Express Bridge Loan that we're working with our local small business agencies. Now, I must say something, undocumented people.
Yes, please.
Well, let me tell you. One of our good friends, as you all know, his name is Patrick Gaspar. You all know who Patrick Gaspar is. He runs the Open Society under George Soros. And his kind heart came up with a great idea where he gave $20 million. He authorized $20 million to go to New York City Immigration Affairs and Mayor's Fund. So with that $20 million, they allocating it to nonprofit organizations that will give undocumented workers, people who work, undocumented workers, $400. It's like a stimulus check. $400 for an individual, $800 for a couple, and $1,000 for if it's like a household.
Oh, as a one-time payment?
As a one-time. It's almost like what we got for the stimulus check, like the $1,200.
Okay.
I got the stimulus check. So my job, and Councilmember Farrah Lewis, who's a city council member in Little Haiti, who just got elected last year, we have been working with immigration to make sure that Haitian organizations were receiving the funds because they are on the ground. They know the undocumented workers, okay? Yeah. Typically, very often they give these money to these big corporate nonprofits.
Yeah.
They have nothing to do with us.
And general funds. Sorry.
Right, exactly. And they come in and they come to the small nonprofits and say, hey, give me your database. Mm-hmm. Why can't the money go to the nonprofits, the small nonprofits? So that's what we're working on. And so we have one of the largest immigrant communities. So it's not only Haitians, it's, Caribbeans, it's also Southeast Asians as well. We also have Latino in our district. So in New York City, it's just a big conglomerate. So we're working diligently to make sure we address a lot of issues around the immigrant community.
Thank you so much, Assemblymember Bichotte. That I'm, so thrilled to hear all of the work that all of you have managed to do in New York, in different people who are thinking outside the box. I actually used to work for Soros Foundation a long time ago. So I'm happy to see that they're an organization in time of need. They always find a way to help the most vulnerable. So I'm really happy to see they're continuing with that trend and that they actually have stepped up to even it's a little bit of help, but something is better than nothing. So thank you for the great work that you're doing. So now we're going to shift gears and we're going to go to Marleine Bastien. And Marleine, if you could introduce yourself. I don't feel like I can do you justice. So if you could introduce yourself briefly, and then after that, I'll ask you a few questions pertaining more along the lines of community advocacy, gender, and the great work that you're doing at FAM.
Mm-hmm. First and foremost, I'd like to thank NAAHP for this great initiative to put this meeting together, and thank you for such great facilitation, Madam. And I'd like to say thank you and to my co-presenters, Assemblywoman Bichotte. Thank you. I receive your information all the time. The last time I saw you was when we were in New York for the lawsuit, TPS lawsuit. I don't know if you recalled. So thank you for your leadership, and Nurse Patti. Thank you for your great work and health activism. We do need that. We need your expertise as a healthcare professional, but we also need the advocacy aspect of your work. So thank you for that. And the entire team who've led such a great communication, thank you. So Marleine Bastien, founder and executive director of Family Action Network Movement, formerly known as FAM, Haitian na Miami, and FAM, it's still FAM. I am the director of a center located also in Little Haiti. Assembly Bichotte, when you were talking about Little Haiti, I was thinking, oh, there is a little. Of course, I knew that, but hearing it was really a pleasure. So we are located right here in Little Haiti. FAM is a one-stop center. We provide wraparound services to 10,000 families a year. but we are also a membership organization. We organize our members around issues of importance. Some of the services that we provide at the center, located in Little Haiti, is access to mental health, counseling, crisis intervention, domestic violence intervention, moun fami ki gen problem avec violence dans kay, access to health care, which we consider a basic human right. Florida is home to a lot of immigrants. We are most of the TPS recipients, for example, reside in the state of Florida. So a lot of the refugees coming from Brazil, from Chile, they also end up in Florida. So access, because they don't have papers, we play a big role connecting them to a medical home, which we feel is so important. And then especially now we understand that, you know, health is vital, and then it is important for us to connect people, whether they are documented or not, to connect them to health. We also have after-school programs for our kids. We have an adult education center. In 90 days, we teach our members how to read and write, and then we teach them how to use the computer, which we realize is so important right now, even though there's still a disconnect, a divide within our community, because most of our people realize, most of our members, you know, are not equipped, right, to access the virtual schooling or virtual services. So this is a big problem. We also organize campaigns. Some of the campaigns we are working on right now, as you may know, is the TPS campaign, gentrification, climate gentrification campaigns, where our people are being pushed out. So we organize around that. We've been organizing for years around comprehensive immigration reform. In the case of temporary protected status, we are organizing now to find a permanent path for the 300,000 TPS recipients. 68,000 of them are of Haitian descent. And in a nutshell, we provide services, but at the same time, we give the tools to our members to contribute to their own transformation and empowerment. And that's what we do. And thank you for the opportunity.
Well, wonderful for telling us about the work that Fund does and the tremendous impact that it's having in South Florida, not just in the Haitian community, but a lot of other communities, multiple ethnic groups benefit from the work that Fund is doing. We know that the ethnic disparities are very evident with what's going on with COVID-19. If it wasn't clear to people in the past, the level of inequity in our system and how bad it is, COVID-19 is making it very clear who's getting sick and what groups are getting sick, and types of workers who are getting sick, and who has access to even being able to do virtual education and virtual learning, and who doesn't. You know, the cleavages in our society are opening up where you can only, you cannot deny it as much anymore. Yeah, depending on who you are, I suppose. But my question to you is, given these ethnic disparities, what are you seeing in Florida in regards to COVID-19, and how, you know, the state, the city, Miami-Dade, Broward, perhaps, how they are responding, and primarily how is that, and what is happening with our community? Miami-Dade has South Florida has the largest Haitian diaspora community in all the United States. We're about almost a million, or about a million. So tell us about what is the situation here in South Florida?
Okay, so as you indicated before, in Florida there are 49,000 cases, right? Most of the cases are located in Miami-Dade County. 16,000 of them are in Miami-Dade County, and when we look at the map, actually we can see the niche where most like mostly Latinos and Black residents reside. Unfortunately, we do not have the data specifically pertaining to Haitian Americans, because, like as Nurse Patti indicated earlier, we are or lumped under African American. But when we look at the niche where most of the cases are in Miami-Dade County, we realize that that's where most of the immigrants, mainly Hispanics and African Americans, and of course Haitians fall under that, and where the low income families reside. So that's what we are seeing in Florida. There are about 39 testing centers in Miami-Dade County, but for most of them, you have to either show symptoms, right? You only one of the centers, members are able to actually walk. You have to have a car. You have to have a car to be able to drive to these centers.
What if you don't?
Pardon me? And most of our members, that's the problem, most of our members do not own cars. We were very happy because recently in the city of North Miami, their center opened up where people can actually walk in, but they have to have an appointment and they have to exhibit symptoms. There is the last center that was opened up in North Dade. Again, you have to have a car, you have to be able to make an appointment. And as a result of language barriers, if you don't speak English, and then that was another concern of ours at FAM. Most of the information was being shared in English and sometimes in Spanish and not Creole. The only time the information was shared in Creole for people to understand was when they opened up this center in North Miami, which this is where most of the Haitian Americans live. As you know, the mayor is a Haitian American, and the majority of the council is also of Haitian American, majority Haitian American. So at that center, the information was shared in Creole, but for the most part, most of the information is either in English and sometimes English and Spanish. So there is an issue with access, because if you either have to have a car, and people have waited, and I specifically had a friend who died because he was afraid to go to the hospital, and he waited at the last minute, and then by the time his wife decided to bring him to the hospital, he died. So our members, our community lacks this access. They lack a lot of them are undocumented. Even though they may be showing symptoms, même si yon gen symptômes, they are afraid to go, because we know that in some of the centers, they ask for a driver's license or an insurance card. But if you are undocumented or if you're low income, you don't have insurance. And we know in Florida, we have many of our low income members who do not have health insurance. So that is a challenge, because people may have symptoms, but they wait at the last minute because they either don't have documentation, they don't have health insurance, or they are scared because they are undocumented.
It's a lot. It's a lot of different variables. Exactly. What are you seeing from your vantage point? You've highlighted so many opportunities or missed opportunities, and I remember when all of this began in February, I was in my neighborhood at a store. Most of the people primarily speak Spanish. And I remember I kept on thinking, is this message translating when messages are given out generally through main media channels in English? But in certain neighborhoods that are, whether it's Creole or Spanish or another language, I felt like the message didn't hit until perhaps days or if not weeks later. In terms of the dissemination of what is actually really going on. And so I'm curious from your vantage point, now that we know this is what the situation is, what is the expectation on civic government to help mitigate some of these circumstances?
Yeah, we are happy that finally they realize that a lot of people do not have cars. A lot of people are afraid to access to go to the testing sites because they are scared. A lot of people are limited because of the language barrier. And then we realize that they are identifying a niche where most of these people live to add more centers. Oh, and then we organize around that is that they use some of the community-based organizations. We received, for example, at FAM, many calls. Mon kap di non, Marleine, pour qui ça va mettre un centre pour tester non là dans centre femme nan? It would be ideal because even though we were closed physically for the past 8 weeks, we transitioned to remote service delivery. Most of our case managers and organizers were working from home. Each time we came to the center, people were waiting because they didn't have anywhere to go. They didn't have anywhere to go. We opened up our doors for the first time this past Wednesday, but guess what? We didn't advertise it on our radio show, Voix Femme. We didn't advertise it on Haitian television. We didn't advertise it anywhere. But when we came, we were packed because people have been waiting. They need to access these services. Now, not only Haitians have problems with the language, we have also Latinos from the Mayan culture.
They're coming.
I visited Guatemala. A lot of them do not speak Spanish. They speak other languages.
Indigenous languages.
So the language access, is extremely important. So I think one of the things that we are advocating for is for these testing centers to be made more available, more accessible, and then to allow folks to come in and be tested. Because you don't, right now, for the most part, you have to be symptomatic, right? And you have to be tested, or you have to be 65 or over to be tested. So that's the issue. That's the issue.
So Marleine, so now that you're on this platform, there are a ton of people who are listening in. From a community perspective, how could we, I hear what you're saying about perhaps certain community centers like FUM and others, great places to do testing. Why not? It makes perfect sense. People already know these are valuable places in the community. People are aware of them. Is there anything you think us as community members living in South Florida, would it help if we call our elected officials in your district? Is there anything we can do?
So we are also organizing about that, like, the HERO Act, for example, passed the House recently, led by Speaker Nancy Pelosi. But we know that the chances that it passes the Senate is nil. But we are organizing around that. We are asking our members to call their senators in Florida. We are targeting Senator Marco Rubio and Senator Rick Scott, and we ask people to do the same. There is also in that piece of legislation, there is also provision for those who are undocumented to be tested and to receive some benefits. There is also provision for TPS and DACA recipients. So this is a good bill for the community to rally around. And then we at FUM, we are organizing around that. We are advocating around that. We were planning to go to Washington, but as a result of the pandemic, we weren't able to go back. We were there in January. We were not able to go back, but we're still organizing virtually. So if you wish to participate in our advocacy work, to make sure that these testing centers, are organized in spaces where people have access, right? If you wish to advocate for the undocumented to be able to access, not only to access services, because a lot of these undocumented, as Assembly Bichotte knows, they work and they pay taxes, but guess what? They are not eligible. Folks who are watching, no même tap gade, même le monde n'a travail, il paye taxes, pas vrai? Il fait partie de 19 millions monde qui sans document, et qu'on a gagné dans capitaine de là, qui fait partie de 19 millions de monde qui sans document, n'ont pas gain accès à bénéficieux, n'ont pas appliquer pour unemployment. And this is extremely important because most of the biggest part of our work right now is to assist people with unemployment benefits, to assist the small businesses, because even though the resources exist, right? Many of them do not qualify, like the Assemblywoman said, indicated, because a lot of these businesses, they are mom and pop's businesses. They don't even have the right papers. So we have a community that is suffering. We have a community that is really reeling, that is suffering from the brunt of this pandemic because they are not working, they are not getting a paycheck. We have our members who've been working at the same company for 40 years. They are just sent home. Now they are not being followed. They are sent home without a paycheck. In Florida, when I was hearing Assemblywoman Bichotte talk about some of the great benefits, the resources, about the Source Foundation, and I said, we wish we had access to some of these resources because communities of color, immigrant communities, they are suffering the most right now. Those who need the resources the most, moun ki bezwen aide la plus, they are not getting access, y ap soufri, yo pa gen l'argent. So we're doing a lot of unemployment applications, and up to now, even people who applied in March, they've yet to receive a check. Yeah. So it is a challenge when you're going pile problem. And lastly, in terms of the virtual learning, virtual schooling, our community is prepared. Our community is the least prepared because the parents have to play a very important role in helping the children to get on. A lot of them do not have any connections, and a lot of them do not have laptops, and we still have a great percentage who are still not accessing virtual schooling. And then most of these children are from our own.
And so these kids right now, they're just missing school, basically.
They are missing schools. And the other challenge is that the level of literacy, our members' level of literacy, because the parents have to have the capacity to support the children, to review their work, to make sure that they are on schedule, to make sure that they are hooked on. But a lot of our members, they don't have that capacity because of the level of literacy and because of the lack of connection and the digital divide. Yes. So these are some of the problems that we at FAM, we are identifying.
Well, thank you so much, Marleine. That was wonderful. And it is unfortunate that down here in South Florida, we don't seem to have the level of resources that New York has.
Yes.
It really is. I spent a lot of time in New York before I moved down here in the nonprofit sector. So I am very well aware of New York has a very, very robust nonprofit and funding capacity that I think is somewhat unparalleled actually in many other states in this country. But I'm happy to see that people like Assemblymember Bichotte is taking full advantage and helping to support our community. So thank you very much. And now we are going to shift gears and we are going to talk to Dr. Gardere. Did I pronounce your name correctly?
Yes, you did.
Awesome, wonderful. Thank you for joining us. We appreciate having you here. I thought it was when I saw your bio and it says you are, you are the people's psychologist or the what is it that your tagline? I thought it was
America's psychologist.
America's psychologist. I love it, I love it.
I changed my title to Haiti psychologist.
Yes. So May is meant to...
Hello, everyone. And hello to, of course, Paul Altidore.
Yes, wonderful. Hi, Paul. Okay, so May is Mental Health Month. So this is definitely a great time for us to now switch gears and to move on to our next topic. We're going to move into mental health, a silent but very potent reality, because often with mental health issues, they may come later after perhaps the immediate crisis. And in some situations, there are issues in homes and families are happening right now. So we're very pleased to have you, Dr. Gardere, America's psychologist, with us. And so what I'd like for you to do, and I've asked every panelist to do this, if you can do a brief introduction of yourself, and your bio will be put on the chat section of the different social media platforms we're using. But if you could do a very quick introduction of who you are, what you do, why you do it, and then after that, we will jump into, you'll have about 10 to 15 minutes, and I'll ask you a few questions, and you'll get to speak on all things related to mental health in our community.
Sure, absolutely. I'm a clinical psychologist. I'm also an associate professor at the Touro College of Osteopathic Medicine in New York City. I've written several books and of course have a private practice in Manhattan, now all over the world, thanks to COVID-19, right? We're so connected through the internet. It's so funny, way back when in the old world, and I'm not talking about Haiti, I'm talking about the United States, the old world. It was the old world. We only could practice within state lines, right? You couldn't treat someone in Florida or what have you. But now with COVID-19, all of those lines have been dropped. We can practice across state lines. And so now it's a new mission and a new time. And I don't want to embarrass Assembly Member Rodneyse Bichotte, but we have to acknowledge the fact that she has helped so many New Yorkers, so many people in Brooklyn, so many people, and I will say in the tri-state area, beyond what her district is with regard to mental health issues, physical issues, and everything else. And I didn't want to embarrass you, but you know, sorry, but you've done the work, and we tip our hat to you.
So Dr. Gardere, I feel that you, I mean, when I was looking at your bio, you've been on TV shows, hosting, doing all things related to mental health, and you've been featured in different news platforms as a speaker. So we're glad that you are able to join us and are able to share some of your expertise with us. So my first question for you is, what do you think are the long-term mental health impact of COVID-19 on our community? Given everything we've discussed, what should we be looking out for and being mindful of during the next few months, not few years?
Mm-hmm. Well, I'll keep it simple. Of course, we've seen some real issues where there may be educational deficits, but I believe as parents, and our guest just talked about this, Marleine just talked about this, I think it's important that we take the reins in working with Department of Education in New York, and I know we're all over the world with this, but wherever your school district is, and making sure that our kids do get a proper education and making sure that we become their teachers too. We can find so many different ways to teach, but there are going to be some educational deficits. I think that we need to be cognizant of. As well, I believe that there are going to be long-term mental health challenges. I don't like the term mental health illness, mental health challenges that we're all going to be going through. We're talking about anxiety, depression, acute stress, post-traumatic stress disorder, right? Where we all know what anxiety and depression is, but post-traumatic stress includes anxiety, depression, nightmares, flashbacks, intrusive thoughts, trying to avoid things that remind us of the traumatic event. And that's the key here. We have all been traumatized by this. All of us who are sitting here who, have high cognitive levels and are helping everybody else. I know when we go home at night, I know we sit down and we wonder, what the heck just happened? We were in one world 1 minute, and now we're in a new world, and it's like, wow. And so it's a culture shock. And all of those things, it will take time for us to catch up. So it's important that we address our mental health challenges, that we use telepsychology, that we stay connected with other people. I think another thing that we will see is, of course, that we will have to adapt to the new world. We will have to find different ways to educate, different ways to learn, different ways to connect with one another. Shaking hands may be out, that may be gone, okay? And even before COVID-19, all of the scientists were saying hands were one of the major vectors for passing on disease and illness and so on. And so we had gotten into doing the elbows. Now we have to do air elbows, right? Yeah. So we can't touch elbows anymore. So we will have to do social distancing for quite some time. And then I believe that there are going to be, of course, not just psychological repercussions. Think of this as an earthquake, and we all know what earthquakes can do, being from Haiti, right, or descendants of Haiti. But now that we've had the earthquake, now we have to look at the after effects. They're not just psychological, they're not just physical, but they're also financial. And it's also going to change our society fundamentally. The way that we relate to one another, the way that we love one another, the way that we speak to one another. And so now more than ever, and again, the assembly member, I don't have to tell you this, she knows this, our ambassador, Paul Altidore, he knows this, we all know this, that united we stand and divided we fall. We cannot allow the political agenda that we see in larger government trying to divide us and using hate in order to try to control the people. More than anything now, what we have to learn is that we must work with one another within our communities, within our families, within our states, within our cities, within our different forms of government. So I think those are all of the things that we're going to see. And our kids may have nightmares for quite some time, but eventually, what comes from the post-traumatic stress disorder is something we call post-traumatic growth. How do we come out of this stronger than when we went in, especially as people of color? Now we know the importance of eating well. Now we know the importance of an equal mental health and medical system, which again, the assembly member has started putting together. Now we know the importance of exercising. We must exercise because there'll be other waves of this coronavirus or other viruses. We're going to have global warming, and it's us who have hypertension and heart issues and diabetes and advanced stages. We are the ones who are going to be more at risk for dying and catching these viruses and dying. So we're going to have to recreate the way that we live on this planet, and we're starting to do that right now. But, you know, the issue is we may be going out there too quickly and without enough protection. And if Sigmund Freud were a Haitian, you know what he would say about this?
What would he say?
Chat qui trop pressé, fait petit, GPT. Slow down and do it the right way. Moderation is the key. Slow and steady wins the race.
Dr. Gardere, I'd like to ask you, so you mentioned family, and that's something I would like for you to talk about from the vantage point of those of us who have older parents. What can we do to, because mental health is very taboo in our culture. That's just a reality. I feel like with perhaps the younger generations, as more people are opening up, more willing to discuss, seeing a therapist is becoming more normalized. But for older people, it is something that it remains taboo. So I'd like for you to look at it from two vantage points. First, as people who are who have older parents, what are ways to help them cope, as well as with children, right? Because there are many of us who are in that middle place. So you have children as well as elderly parents who are both being impacted. What suggestions do you have how to have these conversations to help them develop the coping skills, both the younger kids to develop the coping skills and also the older people who would just say, why are we talking about these things? So what would you say?
Well, I really believe in taking people by the hand and leading them to where they need to go. So with our older persons, with our parents, with our grandparents, it's you can't lecture them because certainly they have more wisdom than we do, but we do have information that can help them. So it's not about just talking to them, but it's about putting information in their hands. It's not about just putting information in their hands, but saying, hey, listen, we're gonna take you out for brunch, okay? Or we're gonna make you brunch, but then we wanna take you to see so-and-so, or I brought you a laptop and we're gonna sit down and we wanna connect you with a Haitian therapist or someone you can talk to as to what's going on, or connect you with an informal support group. I really believe that, you know, you can flip the script and trick the devil. You don't have to call it therapy. You can just call it, hey, let's sit down and let's just talk to a couple of people. We're gonna put you on, we're gonna show you how to use this. Listen, if old geezers like myself have learned to use Zoom, any old person can begin connecting in that way.
Awesome.
And for our kids, I think the most important thing we can do for them is to model the right behaviors with regard to dealing with trauma, talking about it. A study was just done where they found that kids as young as 6 or 7 years old, they know when you're faking it. They know that, you know, you're trying to hide something from them. So you need to be honest with them. Of course, speak with them on their level, find out what it is that they need to know, what they want to know, what they're thinking about, communicate with them. You don't have to ask direct questions, but open questions, but begin establishing that rapport or communication as to what's going on in their lives. What are they doing on the net? Who are they connecting with friends? And that gives you a pathway to talking with them about practicing safer behavior, social distancing, going back out into the world and having, being a little bit smarter about staying safe. And of course, modeling that for them all the time, washing your hands, being able to make sure that when you go to a supermarket or what have you, or you go out, that you wear your mask. So model all of those things for your kids and it will become part of their culture.
Modeling good behavior for children will certainly help. And with parents, it's share information, don't lecture, and lead by just being helpful and finding ways to get them to keep up their spirits through different ways of communicating with other people and using technology.
Because you know what we're finding with older persons is, you know, the more advanced in their age, the more disconnected they become.
Yes.
Why? Because we start losing interest in them. Why? Because we feel, well, we could just see them at a certain time, they'll be okay. Why? Because they go into nursing homes and we leave it up to the nursing home staff to entertain them and so on. And I think we have a real fear of death. We shouldn't, you know, it's part of the natural cycle. And therefore, because of this fear of death, we may tend to be a little bit standoffish from someone that we see who's much older, who may be approaching, you know, end of life. And it's real scary to us, but I think we should embrace them as they embrace life. And it's important that we show them that we are there for them and that we're not afraid.
And that is wonderful. And because we know with older people, there is a technology divide and them not having as much access to these tools. And so they can't go out and hang out with their friends at church or do the things that they normally do where they can have community. So now's a scary time for them. So thank you for making, for highlighting those points as a way to still help keep them engaged, take the time and teach them how to use their phones and so they could do FaceTime and Zoom with the kids and whatnot. So, so thank you so much. That was wonderful, very informative and very helpful. And I know everyone who's listened in, they've gotten some great tips from you because, you know, for a lot of people, they're living in small homes with big families and going
to see our families again.
Yes, we can. But, you know, when you're in a 2-bedroom apartment and it's 8 or 9 people, it can certainly be a challenge, right?
It can be, but, you know, what a privilege because we have frontline workers, essential workers, and they're not there with their children. They're out there saving lives, and many of us are complaining about being at home. Listen, I was sitting in my living room the other day, and I saw a bunch of kids running by, and I was like, kipichitsayo. She was like, those are your kids. I was like, oh my God, I forgot what they look like. I finally get to hang out with my kids and see them grow up.
Yeah, see, you're also America's comedian as well. So thank you for that.
I wasn't laughing, I'd be crying. Don't get me started, please.
I know. So thank you so much for that. I really, that was very helpful, very insightful. And you brought the humor, which is great because it's often needed.
Well, you know, humor can be healing too. So, you know, watch a little bit of comedy, learn to laugh at ourselves because this is a cosmic comedy, what we're going through.
Yes, it is. In the worst possible way. Well, again, thank you so much, Dr. Gardere. And now we're going to switch gears and we're going to speak with Ambassador Paul Altidore, who is going to give us the perspective of the situation in Haiti. So you're our final speaker, and I think it's a great way to circle back to part of all of this, even though we're living in the United States. Many of us, Haitian American, we carry multiple identities. we all also always care about what's going on in Haiti. And as we know, everybody has family members in Haiti, whether close family members or relatives. So being able to be mindful and aware of also what the impact COVID-19 is having on Haiti, and also what we know and we don't know. What we see right now is the numbers don't look so big, but are the numbers valid? We don't know. So what I'd like for you to do is to first introduce yourself and tell us a little bit about who you are, what you've done and what you do now. And then after that, I will ask you a few questions about the situation in Haiti. And then after that, we'll jump into our to questions from our participants.
Thank you, Milka, for the invitation. I'm truly honored and delighted to be here today. Let me first apologize for the viewing if it's not the right way, because I'm actually in Boston, blackout. So I had to walk out of my house and sit in my car to actually have this thing going. So I apologize if the reception from a viewing standpoint isn't the best. That being said, I'm Paul Altidore. I serve as Haiti's ambassador from 2012 to 2019. And since my departure from the embassy, I've been a full-time dad and also a professor. I'm teaching at the Massachusetts Institute of Technology, commonly known as MIT, here in Boston. I teach in the School of Architecture and Planning. And one of the courses that I've taught this semester that I think is quite relevant to what we're discussing here, I teach a course on diaspora groups. It's not Haiti focused, but there's a large focus on the Haitian American diaspora in the course that I'm teaching. So I do a lot of research. I'm doing a lot of research still in terms of how the diaspora communities are evolving and how they're gaining strength in the US social economic fabric. And that's very true to our community of Haitian and Haitian American here in the States. And I've been trying to kind of make that link between Haiti and its diaspora community and this new diaspora community, especially those of second and third generation demographies, and trying to link them with the country of Haiti. And also looking at kind of the role they could be playing in strengthening the communities here where they live here on the US side, as well as the country of origin of their parents. That being said, I spent quite a bit of my focus in terms of my research in also understanding how the world is changing, and the fact that COVID-19 has accelerated the changes taking place. I do think it's quite fitting that we're having this conversation here today, not just in terms of how it's affecting us as a community, but also looking ahead in terms of the changes that are bound to happen in the way we live our lives, and how we as a community of people, we can position ourselves more strategically in being more, in having more clout and more power to ensure that we take care of ourselves and the community where we reside in the country of Haiti as well. Before I even mention, talk about Haiti directly, I also wanted to kind of put some emphasis on something that most of the speakers have talked about. You know, we all talk about data, and I think Milka, in your presentation, yes, you talked about the 5 million people who've been infected and the hundreds of thousands who have been infected here on the US side. And one of the work I'm doing over the summer, and I'm in the process of hiring a couple of graduate students to help with some of the research, specifically related to the Haitian American community. We all aware of, everybody has friends, family members, and neighbors, and colleagues, and all kind of folks we know who've been infected. But from a formal standpoint, there's been very little research in terms of exactly what's been happening within the Haitian American community as far as COVID-19 is concerned. So I've embarked on this exercise to literally trying to map out exactly what's been happening within the Haitian American community, from in terms of infection, in terms of how businesses are being affected. In other words, for a community like ours, if we are to grow and prosper and gain strength, we need to actually have real data to understand exactly what's happening in our community. So part of what I'm hoping to do over the course of the summer and hopefully in the fall is to really map out exactly the trends and how COVID-19 had really affected us. I'm hoping to make the data speak for themselves in terms of its impact on our community. So I just wanted to put that out there. So at least those of us who are involved in community building, community activism, in community leadership and so forth, I'm hoping at some point to reach out and also hopefully engage some of my students to engage with members of the community in really understanding in real terms the level of impact COVID-19 has had on our community moving forward.
I'm so happy you said that. I'm really happy you brought
it. It's necessary. It's necessary. And again, without understanding what's happening in real time, it's really hard at times to really think strategically on the way forward. So part of that exercise, I'm hoping it would be useful to community leaders and others in trying to understand how they can position themselves in this new era that we're entering right now.
Yeah, because data is power, right? It gives you insight. You can make better decisions. You have more information. You can be more strategic with the more information you have. And something I've noticed during the last few weeks, all these organizations who some are giving out grants, some are not, but they've used this opportunity. They've used COVID-19 as a way to gather a ton of demographic data from different populations.
Again, ultimately, if we don't have the data to really know what we're talking about, we're still gonna be talking in, we think something rather than we know with certainty exactly what's happening. And more importantly, again, I'm speaking here as a planner, also from the standpoint of looking forward, how do we strategically plan the future of our communities moving forward? I think the data can actually help in really strengthening the community moving forward in that sense.
Wonderful. So thank you for that. You already answered my first question, so thank you. Okay, so my second question for you then is, from your vantage point and what you're aware of, what is the current situation with COVID-19 in Haiti?
Well, so far, the numbers have been low. Again, I let me be cautious how I say this, in the sense that the amount of folks who've been infected to this point, comparing to what, given the lack of infrastructure in Haiti, so far we think we're looking at less than 1,000 people officially, and I'm going by official data here that the Ministry of Health and the scientific committee have been putting out. That being said, not a lot of people have been formally been tested as well. So from that standpoint, it's really hard to have a real sense the level of folks who've been directly infected. That being said, if you look at some of the patterns happening on the ground, they are no different in some ways than what's happening in certain communities on the US side. Namely the fact that, COVID-19 has, usually folks say COVID-19 doesn't discriminate, but COVID-19 doesn't impact folks of different social economic background the same way. In other words, the same way many other folks are on the US side. If you look at, the bus drivers, the folks who work at supermarket, many of the frontline workers who have been heavily affected on the US side, many folks in Haiti are facing that same dilemma. Folks live on a daily basis, so they have to venture outdoor. So hence, they're exposing themselves more than those folks who have the opportunity to stay at home and actually follow social distancing procedure in some ways. That being said, the fact the numbers are low, I don't think it's necessarily an indication of the level of how COVID-19 has been dealt with in some ways. And two, keep in mind that this is a disease that has been slowly creeping up on many countries in some ways. So for the past week, the amount of folks who've been infected have increased comparing to previous weeks and so forth. But at the same time, the numbers appears, again, I'm saying this with cautious, the numbers appears to be low, but it's no indication that we're doing such a great job at it, as much as a lot of folks have not been formally tested yet.
Wonderful. And would you say, do you have any idea on why the numbers, or the official numbers as we know it, why perhaps Haiti hasn't been hit as hard as some other countries, which seems...
Well, again, I don't know if we know that with certainty. Keep in mind, I mean, there's something even cultural happening right now. There appears to be folks who are ill and in some cases dying, but there's even been a denial that folks are dying of COVID-19. So from that standpoint, if folks are not, one, being tested, and if in the event they're falling ill and even dying in some cases, you have family members even denying that. Again, I don't want to speak on data that I have not researched on, but there's some cultural aspect taking place here as well, among other things, that makes this process much more difficult. That being said, there are other issues affecting Haiti. For instance, the airports have been closed, but the border with the Dominican Republic, folks have been coming to the border informally in large quantities as well. So from a public safety standpoint, the issue of making certain that folks, circulation of folks are limited in some ways, and we have some control over that. From an infrastructure standpoint, even from a governance standpoint, the country have not been able to fully been in charge of that yet. That being said, again,
the border is not closed. The border with the DRC.
The borders are closed formally, but informally, there's so many different ways people can get in and out. So there's really no control over that in some ways. But beyond the health aspect of it, I think Marleine Bastien was making reference to this. Economically, the country has been so heavily dependent on the outside world. That makes things much more difficult for Haiti in some ways. So imported goods are now very, very difficult to access in some ways, hence making it much more expensive in terms of people's ability to access goods and other services that they may need, that where they depend on the outside world for that to happen. So again, it's a world in full mutation right now. The country of Haiti, just like the community of Haitian American here, they're facing this challenge of ensuring that how do we strategically think the process moving forward. And again, I'm linking COVID-19 to this world of the future here. I'm literally writing an article right now. The government has actually issued a state of emergency because of COVID-19. And the whole issue of trash collection, the whole issue of health and safety. And I'm hoping this is yet another opportunity, just like the earthquake, for Haitian, not just the government, but the state of Haiti, civil society, community-based group, to hopefully seize this opportunity to think differently, because COVID-19 in some ways is forcing us to think differently as well. So from that standpoint, I'm hoping our behavior, the way we view development, the way we view addressing certain community issues, we begin to actually be more strategic and think those things more smartly.
Those are wonderful points. Thank you. And, in regards to your earlier point you were making about the mapping work that you're looking to do, would this be a mapping exercise that's the Haitian diaspora in the US, or more international, global?
Well, I work on diaspora groups globally for my teaching, but as far as the Haitian American community, there's something very important happening here within our Haitian American community. And I think at times we're losing sight of the big picture. Think about what the exercise we're doing right now. I came to the US at a time when being Haitian was not something that a lot of people were even happy to talk openly about. Yeah. And now you have folks of second and third generation embracing the Haitian roots in ways, in forms that we've never seen in the history of our community. The amount of folks like Rodneyse Bichotte who are now gaining access to political office, the amount of Haitian American who are now excelling in different forms in their professional life, is a testament of a level of maturity in the community, but also it's a testament that the guards are changing in some ways. So when I'm thinking Haitian American community these days, I'm not just thinking those who came from Haiti 20, 30 years ago, but I'm also thinking of their sons and daughters who are now professional on the US side, who are leaders in their communities, but also with an eye on what's happening on the ground in some form. So all these changes, again, the world is in mutation. There's a big mutation taking place within the Haitian American community as well. From that standpoint, I wanted to put emphasis on it. And from an academic standpoint, I said, well, let me really do some hardcore research in understanding some of the dynamics happening within the Haitian American community. And more importantly, how do we use our acumen? How do you use our level of sophistication to ensure we continue to grow, we continue to prosper, and eventually thrive in this country where we are right now in the United States?
That's wonderful insight. I love the way you're closing this out with thinking about, often, even in the worst situations, there can be opportunity to create something new. It's often, is an invention is often, necessity is the mother of invention, right? So often it is in these crises, these situations, that perhaps we'll have people come up with new solutions to solve different problems in our communities, whether it's here in the US or in Haiti or Haitians in diaspora all over the world, thinking through not just reacting to the situation, but what are some of the needs in our community and how can we help solve problems, fill gaps, regardless of what generation you are, using the tools and the skills that you have. You are muted. Paul, you're muted. You're gonna say something. Paul, you're muted.
I'm on mute. All right. No, I'm simply saying, I'm sorry here. I'm simply saying that we need to be proactive. And one thing, again, from observation, and I've lived to that when I was an ambassador, the amount of support I received from Haitian Americans here on the US side is a testament of the interest in seeing the community of Haitians, in seeing Haiti as a country moves in the right direction. And I'm simply saying, as a former government official, shame on me, shame on us, if we're not able to capitalize on this momentum. And COVID-19, once again, the level of mobilization. I'm a resident of New York City. Although I'm teaching over in Boston, I saw firsthand the amount of Haitians from the front line who traveled from Miami, who traveled from Atlanta, and flew to New York City to provide their help at hospitals and other parts of where people needed assistance. Yeah. Again, it's a testament of not just the amount of folks out there, but also the resources we have at our disposal. So given what I've seen as a former ambassador and as an academic, what I'm realizing that we have in terms of resources, I'm talking human resources, we need to put more points on the board. So that from that standpoint, I'm simply making this strong argument that there's yet another opportunity that we shouldn't be sitting here 5 years from now, say, what if? There's an opportunity here that I think that can be seized, and with the right leadership, with the right strategic thinking, I think we can make great strides. So at some point down the road, we're not just a community of people who are simply not playing pour problème nous, but we are solving our problems. But more importantly, we're thriving here. We put too much work. We invested too much of our time here on within the communities where we live to simply be at the mercy of others.
Wonderful. So thank you so much. Thank you all for speaking so eloquently and so well on your topic. Now we have a few questions, and what I'd like for us to do is I have two big questions I'd like to pose, and then after that, I would love, as among yourselves, with what we've discussed today, everybody brought a different vantage point, just for us to speak to each other as panelists in terms of what we've learned and perhaps opportunities, whether it's to collaborate or new things, I don't know, and that can also be done, afterwards, but just as a way for us to wrap up this conversation. So I have a question from somebody called Patti, and their question is, they want to know, and I would like to direct this to Nurse Patti. The question from Patti is, does COVID-19 affect different people due to social economic differences or any particular trait?
I think that's a great question. Everything affects people differently based on their socioeconomic problem. I think Ms. Bastien pointed that out. If you're undocumented, if you're poor, if you don't have access to Wi-Fi, that means you don't have access to information. That means that you fear going to a healthcare facility to receive care because you think that you'll be punished, or you think that you will get caught or be reported. Socioeconomic is a big driver in health. Those who are vulnerable have higher risk of mortality, they have more comorbidities than anyone. They have less grocery stores in their neighborhood. They usually live in food deserts. Not having access to adequate food automatically puts you at a disadvantage to living an optimal life, to growing, to literacy. Poverty is almost, to me personally, is the greatest sin, because poverty robs you of so many opportunities. Poverty robs you of nourishment to your body. It robs you of inadequate education. So yes, COVID-19 does affect people differently. If I am white and I live in Calabasas, California, I can have a doctor actually come to my house and test me in the comfort of my home without having to even leave my home and expose myself to a general public hospital. So again, access is very, very important. And beyond equality, equity is very, very important. I think that's a great question. The reason why we see the numbers that we see in the Black community is because of our socioeconomic status. The reason why we see the numbers in unemployment and we see how many African Americans and minorities are affected, especially immigrants, is because socioeconomic status. So whenever you're talking about a disparity or a vulnerable population, you have to know that the most vulnerable of them will be affected. And this is living proof. But just to piggyback on what my ambassador said, because Ambassador Paul is like our ambassador for life. He made decent home for everybody. We, as Haitians and Haitian Americans and first and second generation Haitians, we have to seize on the opportunity, on the access that we have and the networks that we have in our special interest in Haiti. Everybody does something based on their interest, and everyone on this panel has a special interest in Haiti and the Haitian community outside of Haiti. This is the time for us to leverage what we have and what we know and really make a change where change is needed. This is the time to pandemic-proof our professions, to pandemic-proof new strategies. And like the ambassador said, the numbers is the most important thing. Without the numbers, you can't even start to work because you can't identify what the real need is. Yeah. So I think that's a great question. I encourage people to really wrap your arms around your community. Being a good neighbor means if you live somewhere and there's someone elderly that can't leave, that you do you get groceries for them. You leave things for them at the door. We have to go back and embrace that village mentality, because where we don't have the money and we don't have the economic status, we have the resiliency. We know how to make something out of absolutely nothing. So we need to use our human capital to not only raise awareness, but to raise the bar and change the way we do things.
Thank you so much. That was such a wonderful response to that question. I believe Peppy is probably very happy with that. So I have following another question. It is for Dr. Gardere. The question is, what mental health family counseling resources are available for Creole-speaking individuals during this time? And I believe either Dr. Gardere or Marleine, either one of you could probably respond to this, or anyone for that matter, if you're aware of Creole language speaking resources for family counseling.
I do have a resource, and I'm going to look that up, but maybe someone else can answer the question now, but I'll get that resource as we're speaking.
Okay, so you're going to get it for us.
Yes.
Anyone else would like to speak on this as far as group family counseling in Creole language? Marleine, are you aware of anything?
Yeah, well, our center, we provide mental health counseling at FAM. Of course, we are in Miami. We are located in Little Haiti. So we do have this resource available to our members in Creole. We also have parenting classes in Creole, and we also helping our children in the Dade County Public Schools with access through virtually. Because as I indicated, a lot of the parents are unable to support them in that endeavor. So if you are in Miami, you need this resource. Si ou nan Miami ou besoin aide pour connecter. Si ou nan Miami ou se yon nan parent qui pa komete ti moun l'école parce que ou pa gen connexion, ou pa gen internet. Si ou nan Miami ou stressé ou déprimé eh bien, ou gen doit contacter centre femme nan, non retourner full force, non te travail remotely, à distance, en bon créole. We've been working remotely for the past 8 weeks, but we are back. We've been back since Wednesday. Of course, when you come in, we take your temperature. We have to take your temperature, and you have to have your mask on. And then we have mental health professionals here every day, ready to assist you. I wanted to add, if I may I ask something about Haiti, because I really appreciated the ambassador's presentation, but I'd like to add something, because we are happy that so far Haiti's numbers have been low. However, the gon malè pandie qui pandie sou Haiti. Oui. There is a big risk on Haiti right now, because the US has been deporting detainees who have been tested positive for COVID-19 or who have been exposed to COVID-19. At Com Detention Camp, which is located at 45 minutes where we are, we have most of our detainees who are being deported to Haiti right now. They've been exposed to employees from the Com detention centers who have been tested positive for COVID-19. We've been organizing at FAM. If you go on our social media platforms, we've been organizing, asking the US to put a moratorium on all deportations to Haiti and to other nations, number one, and then to make sure that those who have been exposed to people who have been tested positive for COVID-19 not be deported to nations that do not, like Haiti, that does not have the capacity to really manage a pandemic of this magnitude. So I wanted to alert you to that, Ambassador. I know we did a lot of organizing and collaborating together on temporary protected status. We really miss you in DC, as I said, but I wanted to bring up this malè pandie, this big challenge and défi that can really change Haiti, yes, that can create a very difficult situation for our Haitian people, who 11 million people who are not able to practice social distancing, right, because of overcrowding. So I wanted to alert you to that aspect of the work, and then we'd like to ask you to join us to make sure that our voices are heard, and that people who have tested positive and are not deported. And we were successful, by the way, because some of the members who were about to be deported, 3 members were about to be deported a week ago. They were removed at the last minute as a result of our local and national advocacy, and we want to continue to do that, but we would like to ask you to join us. Go on our platform, FAM platform, to assist and do your best, so that
thank you, Marleine.
Haiti can be safe. Yeah.
Thank you very much. So Dr. Gardere, I believe you have the name of the resource that you mentioned earlier, that you would get the information in Brooklyn, which is great, because Marleine just gave us a good example of FAM. It has a number of resources for mental health in South Florida, but for the people in the Northeast, like in Brooklyn, New York, Dr. Gardere.
Yes, it's the Global Trauma Research. I sent it to your organization so they can post it. Okay. The Assembly person knows about this. It's a Global Trauma Research, Dr. Florence Saint-Jean. And the phone number is 800-461-9350, 800-461-9350. And those services originate out of Brooklyn, but I believe they serve anyone in the New York area.
Wonderful. Thank you so much for sharing that resource. Okay, so we have another question. We have a question for Assembly Member Bichotte. The question is from Woody Blaine. His question is, he wants to know, can illegal immigrants get tested without fearing getting deported in New York?
Yes. So
tell us more.
Yes.
Or
so
undocumented.
In New York City, we do not discriminate based on your status. We do not even ask you what your status is. You come in, you get some information, and they test you, and that's that. And we provide we can send people to places where they speak Creole. So this is one of the reasons why we actually had the center right in Little Haiti, so that people can feel comfortable going there. So yes, we know.
Thank you so much. So Woody, yes, if you're an undocumented or undocumented person, they can get tested without having to disclose their status, their immigration status in the US. Okay, so I have another question for Ambassador Altidore. The question for you is, where can one find more information about your COVID-19 research in Haiti and look for opportunities to contribute?
Well, I'm not formally doing COVID-19 research in Haiti as much as I'm mapping out what's been happening within the Haitian American community here on the US side. That being said, I am involved with a couple of researchers and universities in Haiti addressing COVID-19 from a standpoint of economic development post-COVID-19. So from the outset, I made the point that the world is in transition and COVID-19, and this transition I'm making reference here to, in my view, it was in the making prior to COVID-19, and COVID-19 only accelerated that process in some ways. In other words, there's a set of changes taking place in terms of how the world produces goods and services. Think about it. I live in New York City. It was only maybe 2 weeks ago I was able to gain access to a mask that I could buy, I could purchase, in part because they were just not available. And what I'm saying here, the mode of fabrication, the mode of, again, the whole economic model in some ways, as we know it, is changing in front of our eyes. And part of what we need to understand is to kind of see where the world is heading and how do we position ourselves as a community of people to ensure that we take advantage or we understand better where the world is heading in some ways, to take advantage of those things. In some ways, I'm saying I work at a research institution called MIT. And today, let me just take a quick example. It's easy these days to make a car part with a level of equipment that maybe 5 years ago used to cost $200,000-$300,000, but now you can actually make it at home. That same equipment you can buy for $2,000. It's no different than what we saw with the internet age. That's what's happening with the fabrication age in some ways. Again, I'm simply making the point that COVID-19 is forcing us to think differently, is forcing us to behave differently, and now we need to be more strategic how we do that, make that happen. As far as COVID-19 research in Haiti, there's a lot of numbers out there. There are institutions on the ground doing and providing some of those data. It's simply just like the Haitian American community. Most of the data that I'm looking for, they exist already. I'm simply gathering them and centralize that data, and more importantly, making an analysis of that data in some ways. Awesome. So if folks are interested, again, feel free. I can pass out my email address to anybody. As an academic, I can provide some of that information, and if they want to decipher some of that data. But the work on COVID-19 on the US side, it's beginning right now. I literally just hired a couple of graduate students, among other researchers, to help us with that work.
That's wonderful. All right, so we don't have any more questions. So what I'd like for us to do now, we have about 3 minutes. I want for us to finish on time to give you all back your time. So what I'd like for us to do is for each one of you to go around and say one final thought. Just to wrap up, to say one final thought, as well as where people can find you. So depending on what organization you're part of, your social media, if anybody wants to stay in touch with you or connect with you, how and where can they find you? So if you could do that, I'm gonna give everybody about 30 seconds to 45 seconds to go around, say your last thought. If there's a last thing, a last ask you'd like to make of our community, or last parting words, I'd love for us to do that now. So how about we start with you, Assemblymember Bichotte.
Thank you again, Milka and NAAHP, for allowing me to join you and share some information and resources. You can reach me, my office number is 718-940-0428. Or you can go to my website, which is www.rodneysebichotte.net. It's actually a website that I built my own when Ambassador Altidore said we had to think different and forced us to do different things. Yeah, I had to learn how to build my own website. So www.rodneysebichotte.net. And you can also email me at rbichotte@gmail.com. that email is exposed to everybody, and I do respond to my email. But certainly, if you're looking for any resources or any information that's best practice that you can share across the U.S., I'm available. Again, thank you for having me.
Thank you so much, Ms. Bichotte. Thank you. And next, Patricia, Nurse Patti, parting words.
I'd like to thank the NAAHP, and I'd like to thank every last one of the finalists for just spending time, and everyone who tuned in. I'd like to thank them as well. As a frontline nurse practitioner, I would like to thank all the essential workers that are really holding the country and the thread of the country together right now. If anybody wants to get in contact with me, my website is www.thelafontantfoundation.com.org. I'm sorry, that's my nonprofit, the Lafontant Foundation.org. And I just hope that everybody continues to stay safe, stay healthy, stay innovative, and stay pandemic proof. God bless y'all. Thank you for having me.
Thank you so much, Nurse Patti. And then next, I would love for you, Dr. Gardere, if you could say final thoughts.
Yep. People can reach me at Dr. Jeff Gardere. I guess that's the Twitter handle. I do have a website. It's drjeffgardere.com. Assembly member Bichotte, I wasn't able to build one. I just don't have the skill. Faster, I hope you don't mind. I had to pay someone to do it. I just want us to come out of this thing stronger than the way we came in. We've got to make fundamental changes in our lives. We can't depend on anyone else. As Haitians, we do pull ourselves up by the bootstraps, and I would encourage all of us to do that. That's our mission now, to be better for the new world.
Awesome. Thank you so much. And I would like to now ask Marleine, if you could say parting words, please.
Thank you so much for such a great facilitation again. Thank you to the organizers. Thank you to the co-presenters. It was an honor to share the space with you. And I'd like to invite you to join a task force led by Dr. Gerda Nicola from the University of Miami. There are different committees, mental health et al. So please join. And if you want to reach out to FUM, it's www.fum.org. Our number is 3057568050. And then you can find us on social media. You just type FUM.org. And I know we are going through difficult time, but I want to invite you to stay together, support each other, and that we will prevail.
Thank you so much, Marleine. And finally, last but not least, Ambassador Paul Altidore, if you could say your final thoughts and also how people can reach you.
Thank you for having me once again. And let me emphasize the necessity for such engagement to continue within our community, whether it's at the family level, whether it's at the community level. It's imperative that we continue to engage with ourselves. Again, we have too many resources at our disposal not to take advantage of them in some ways. So I'm hoping this crisis is yet another opportunity for ourselves to lift our community forward, whether it's a community where we live here on the US side and the country of Haiti where we have strong bond with. That being said, I'm available. My email address it's public. It's altidorep@mit.edu. I'm just want to be involved with folks who are interested in constructive conversation. There are many things we can find that divides us, but we have many more things in common that can lift us together. So from that standpoint, if you have a positive conversation, I'm game with anybody out there.
Awesome. Thank you so much. And I'd like to say my final thoughts as well is I encourage everyone to stay connected to your loved ones, your community, who you care about, do things to keep yourself hopeful and not fall into despair, and support one another and be compassionate and empathetic, because we're all going through something. Often we don't know what another person could be dealing with. So let's just all be mindful of that. And I encourage everyone to reach out to any of these panelists to have constructive conversations and dialogue. And I also would like to take the time to also share my information. So you can, I'm on also all the social media platforms, but the ones that I'm the most active on is probably LinkedIn. So Milka, Milliance, that's pretty much my name. And for Instagram, Artemis Speaks, as well as Twitter, we are Artemis1. That information, I've asked the organizers to share our social media on Facebook and YouTube, so you should have it in the chat section, the comment section of whatever platform you're watching this through. And lastly, I want to give a big shout out to NAAHP for organizing, for hosting this, the time, the effort, the energy, the planning. We're very grateful for bringing us all together. Thank you guys for all that you've done, the entire organizing team, as well as Shakarala for doing this live stream and being a media partner. I certainly look forward for us to hopefully have another one of these events soon to share perhaps another perspective, another aspect of what's happening right now with COVID-19 or hopefully in the next weeks or months. But that is to be determined. So more information will be shared in the next few weeks regarding that. Again, thank you to everyone. Thank you to each panelist for your time, your effort, your energy. Really appreciate it. For participating, for sharing your expertise on a Friday night at 7 o'clock. Thank you. We do appreciate it. So for your contribution. So I will leave us all with that. So again, thank you, everyone. Thank you for your participation. Thank you for your wonderful questions. And feel free to reach out to any one of us or the NAAHP about other ideas. So merci en pile, nous apprécions participation, nous que nous tout te ka moun ki te fait faut te ka attendre. This is going to be recorded. So this is recorded and will be available. So sou ta vle voye ba an lot moun, ou vle tande l pita, information li la, li son recording, li la ou ka attendre n'importe, ou ka gade n'importe le sur Facebook ou bien YouTube on NAAHP. So again, thank you very much and have a wonderful evening and a great weekend, everyone. Thank you.
Thank you.
Merci. Kembe fem.
Thank you. All right. So.